Hi, good morning everyone. I'm THANALETCHMY PARASURAMAN. Good morning, Professor SAMINATHAN. Today I'm going to present about HIV and AIDS. HIV means human immunodeficiency virus. For the AIDS, they're defined as acquired immunodeficiency syndrome. Next, we move to the next slide. Okay, this is the table of the content which is inside my slide. Okay, next we move to the introduction to HIV and AIDS. So the definition will be a virus that attacks the human body or human immune system, specifically that CD4 cell, which means T cell. Over time, HIV can destroy so many of these cells that body can't fight and the infection and then the disease. So for the AIDS, the most severe phase of the HIV infection occur when the immune system in the badly damaged in the body and become vulnerable to opportunistic infection or cancer. Diagnosed when the CD4 cell count fall below 200 or specific opportunistic infection or cancer are present. Next, we move to the next slide. Okay, this is the differences between HIV and AIDS. For the HIV, it stands for the human immunodeficiency virus, and also the HIV referred as virus that can invade and weaken the immune system. The last one will be the HIV infection does not always progress to AIDS, which means the stage 3, and many people with the HIV live for a year without developing to the AIDS. For the AIDS, it stands for the acquired immune deficiency syndrome, and also is referred as spectrum of condition, usually see in later stage, which is stage 3 of the infection by the virus, means HIV lah. And while a person can have the HIV infection without having the AIDS, anyone diagnosed with the AIDS already has HIV. Next, we move to the next slide. Okay, this is a type of HIV AIDS. It includes two types, which is HIV-1 and HIV-2. So HIV-1 is the most common of widespread type of the HIV. The prevalence is accounts for the majority of HIV infection globally, and the subtypes, the multiple subtypes, which means clades and groups such as M, N, O, P, and particularly the group of M is most prevalent, and it include the subtype of A, B, C, D, F, G, H, J, and also the K. Okay, the another one is the HIV-2. This one is the less common and less virulent than HIV-1. The prevalence is predominantly found in West Africa, and also is found in European and Indian, between the Indian population. So the transmission is the lower transmission rate compared to the HIV-1, and the slower progression to the AIDS. Okay, the beside is called the picture. This one is difference between the HIV-1 and also the HIV-2. It includes the infectionality, virulence, heterosexual spread, and vertical transmission, genetically diverse, prevalence, original, and time of the AIDS. Okay, next we move to the next slide. Okay, this one is the pathophysiology of the HIV and AIDS. First, we discuss about the HIV-1. It starts from the viral entry. The mechanism will be the HIV-1 is targeted CD4 T cell, and also the macrophage dendritic cell. So the process will be the virus bind to the CD4 receptor and co-receptor, which is CCR5 or CXCR4 on the host cell surface, facilitating the entry. So the second process will be the reverse transcription. So that the mechanism will be the HIV-1 is RNA is reverse transcribed into the DNA by the reverse transcriptase. So the third stage will be the integration. So the mechanism will be the viral DNA integrate into the host cell, which is genome using the integrase enzyme. And then the fourth stage, it will be the transcription and translation. So the mechanism will be the host cell machinery transcript and proviral the DNA into the viral RNA. So the fifth step, which is assembly and binding, which is the mechanism can be a new viral particles and the and but from the host cell membrane. So the outcome will be the immature virus are released, and which is mature and become the infection. So the last stage will be the immune system invasion and destruction. So the mechanism will be HIV1 invade the immune detection and deplete the CD4 plus T cell, which is a T cell, and the outcome will be the progression decline in the immune function and lead to the AIDS when the CD4 plus T cell is count for below 200 cell. Okay, next we move to the next slide. Okay, this one is the HIV2. So it start from viral entry. Basically the process is quite similar to the HIV1 lah. So the mechanism will be the similar to HIV1 but primarily used to the CD4 receptor and CCR5 co-receptor. So the process will be the virus bind to the receptor and the host cell surface, facilitating the entry. The second step will be the reverse transcription, means the mechanism will be HIV2 which is RNA is reverse the transcription into the DNA by reverse transcription. So number 3 step will be the integration. So the viral DNA integrate into the host cell genome using the integrase enzyme. The fourth step will be the transcription and translation. So the host cell machinery transcript proviral DNA into the viral RNA. The number 5 step will be assembly and budding, which is the new viral particles are assembled and bud from the host cell membrane. The number 6 step will be the immune system invasion and discretion. So the HIV2 is invade immune detection and deplete CD4 plus T cell. So the differences between the HIV1 and HIV2 based on the pathophysiology is the transmission is HIV1 is more easily transmitted than HIV2, and then the progression will be HIV2 is slower later of progression to AIDS, and the viral load will be HIV2 is typically result in the lower viral load compared to the HIV1. So the prevalence for the HIV1 is the dominant strain globally, whereas the HIV2 is largely confined to the West Africa. Okay, next we move to the next slide. Okay, this one is the picture which is explain about the pathophysiology of HIV and AIDS. First will be the HIV infect the mucosal. Second will be the CD4 plus T cell is destruction and attach to the dendritic cell, travel to the lymphoid tissue and replicate. Infection establishes and viremia, which is HIV spread through the circulation. The last one will be immune response, which is partial contaminant seroconversion ABS. Okay, next we move to the next slide. So this one is the prevalence of HIV AIDS, which is based on Malaysia. Okay, you can see that 1983 the first reported case of HIV will be 3. So 1998 4,624. This one is initially of mother to child transmission of HIV preventing program in the antenatal care. So 2002 6,978, 2006 5,830. So this one is introduction of harm reduction strategy for the injection drug user and free first line retroretroviral treatment in 2006. So 2021 will be 2,760. Which is the people is infected by HIV AIDS. Okay, next we move to the next slide. Okay, this one is the risk factor of HIV AIDS. The first one will be the unprotectable sexual contact, having the vaginal or anal or oral sex without using a condom. So the risk will be higher with the multiple partner or when one partner is getting the HIV positive and then is transmitted to the another partner, something like transmission process, and sharing the needle and syringe. So using the contaminator needed for injecting drugs, tattoo or pacing. So the risk can be the direct exposure to the HIV infected by blood and blood transfusion or organ transplant, receiving blood product or organ from the HIV positive donor. So the risk also is significantly be rigorous screening protocol were established, and mother to child transmission MTCT, which means HIV transmission from the HIV positive mother to her baby during pregnancy, childbirth or breastfeeding. So the highest risk without the antiretroviral treatment during the pregnancy. And occupational exposure, the healthcare worker getting the exposure to HIV through the needle stick injury or contact with the infected blood. So the lower by following safety protocol and using the protective equipment, means it can be the risk, significant risk, which is lead to the HIV infection. So the last one will be the other STI, means sexual transmission infection. Having other STI such as syphilis and herpes gonorrhea, so the risk will be increased the susceptibility to HIV infection due to the compromised mucosal barrier. Okay, next, so this one is the picture which is show how the HIV is transmitted. So using of the non-sterile syringe or tools, pregnancy, breastfeeding, blood transfusion, organ transplant, and unprotectable sex. HIV is not transmitted during the food, drink, insect bite, kiss, touch, or clothes, towel, toilet, and shower. So next will be the causes of HIV and AIDS. First will be the transmission through the sexual contact, blood transfusion, which is receiving the blood products contaminated with the person who getting the HIV positive. Mother to child transmission, which we discussed just now, sharing the needles and syringe, using the needles or syringe contaminated with the HIV infected blood or common with the drug user. Occupational exposure, like healthcare workers getting injury during the workspace, during they doing the work, and they're infected by the blood or bloody fluid, and thus will be the infected body blood products. Okay, this one is similar to the risk factor just now. Okay, next is a person get HIV from having unprotected sex, string needle or for the drugs, facing tattoos, getting stuck with the needle that has HIV infected blood on it, or getting HIV infected blood stem or stamen or vaginal fluid into open cut also of the body, blood transfusion or infected blood. HIV can also be passed to baby during the pregnancy, birth or breastfeeding. Okay, next we move to the sign and symptoms of HIV and AIDS. First will be the acute HIV infection. This one is the earlier stage. So in this stage we can get the same sign and symptoms like fever, fatigue, swollen of lymph nodes, sore throat, rashes. The second one will be the chronic HIV infection, which is clinical latency stages, asymptomatic and persistent generalized lymphadenopathic. So number third will be the AIDS advanced stages, rapid weight loss, recrossing fever or profuse night sweat, prolonged swelling or lymph gland, chronic diarrhea, unusual cancer, nephrology disorder. Okay, this one is the picture which is show what are the HIV symptoms. It can be the night sweat, sudden unexplained weight loss, oral throat, unexplained rashes, swollen lymph node, sexual transmitted infection. Okay, next we move to the stages of HIV AIDS. It starts from the acute HIV infection. The initial stages following the exposure lasting a few weeks. So the symptoms will be the flu-like symptoms such as the fever, sore throat and rashes. The viral load will be high viral load and highly infectious. And chronic HIV infection is happen in the clinical latency stages. The viral remain active but they reproduce at the lower level. Duration can be the last several years with few or no symptoms. The progression will be without treatment or progression to the AIDS. So the last one will be the AIDS, the final and most severe stage of the HIV infection. So the symptoms will be immune system damage and leading to the opportunistic infection and certain cancer. So the diagnostic is CD4 cell count fall down is around 200 cell or present of specific opportunistic infection cancer. So the beside that side got a picture that also is include the stages like acute HIV, chronic HIV and AIDS. Okay, next we move to the next slide. Okay, diagnostic of the HIV AIDS. First will be the HIV antibody test. So it's detect the antibody produced by the immune system in the response to HIV. The test will be the ELISA enzyme link immunosurveillance assay, which is initial screening test. Second will be the HIV antigen antibody combination test. The fourth generation test is detect the both HIV antibody and P24 antigen. So it can identify the HIV infection earlier than antibody test alone. So the blood sample analyzed for the antigen and antibody. So the third test will be the nucleic acid test. So detect the presence of HIV RNA in the blood and use for the earlier detection and high risk exposure cases. So the blood test of the viral RNA providing the confirmation of acute infection. The number fourth will be the Western blot and immunofluorescence assay. It's confirm the test following a positive antibody test. It's detect the specific HIV protein and also immunofluorescence assay is a visual confirmation of the HIV antibody. So the number fifth will be the CD4 count, which means the measure the number of CD4 cell in the blood and determine the stages of HIV infection and help the guide treatment decision. So the blood test to assess the immune system of the health. So number 6 will be the viral load test. They measure the amount of the HIV RNA in the blood and monitor the disease progression and treatment effectiveness. Blood test to quality viral particles. Okay, next we move to the next slide. Okay, this one is based on the HIV testing option. First will be the rapid point of the care, the measurement, antigen and antibody. So the result will be 20 minutes. Standard point of the care, the measurement is antibody and result can be 5 to 10 days. Nucleic acid test, the measurement HIV RNA and result a few days. The last one will be the at home test, measure antibody and the result will be the 20 minutes in one day. Okay, next will be the treatment of HIV AIDS. The first will be the antiretroviral therapy ART. Later we discuss one by one later. And regular monitor and follow up care. Second, the third will be the preventing opportunistic infection. And fourth will be the managing coexisting condition. So the regular monitoring and follow-up care means is based on the CD4 count, which is monitor immune system health and regular check to ensure the CD4 level remaining stable. Or the viral load test, which is measure the amount of HIV in the blood and regular testing to ensure the RAT is effective and suppressing the virus. So number 3 will be the preventing opportunistic infection. So it's based on prophylactic treatment. It's prevent the infection like pneumocystic pneumonias and tuberculosis and other. Vaccination is immunization for the prevention disease and such as the influenza, hepatitis C, B and other infections. So the number 4 will be the managing coexisting the condition, which is antiretroviral drug resistant testing. Is guide the choices of effective RAT regimen and the treatment of the co-infection managed hepatitis B and C. So the tuberculosis and other infection common in the HIV positive for the individual. Okay, this is the continuation of treatment of HIV and AIDS. It's adherence support, which is number 5, and counseling and education based on the patient understand the importance of the ART, and also the support group. It also provides some emotional and physiological support to maintain the adherence. And number 6 will be the lifestyle modification. It includes the healthy diet, exercise, and smoking cessations. So healthy diet is maintaining a balanced diet to support the overall health, and exercise is the regular physical activity to maintain the physical and mental health. So the last one will be the pregnancy and HIV. ART during the pregnancy prevent the mother to child transmission of HIV, and also safe delivery practice, which is reduce the risk of HIV transmission during the childbirth. So the last one will be the avoiding breastfeeding, using the formula feeding to prevent the HIV transmission through the breast milk is safer alternative and available. So the picture is showing that benefit of a HIV treatment is, with the HIV treatment you can bring the virus to an undetectable level and prevent the passing HIV to others. Next we move to the next slide. So this one is the drug classification in HIV AIDS. So the first one will be the nucleoside reverse transcription inhibitor. So the mechanism is blocks the reverse transcriptase and prevent the concentration of the viral RNA into the mRNA. So the example drug will be the zidovudine AZT, and non-nuclear reverse transcriptase inhibitor, which is NNRTI. So the mechanism is bind to and inhibit the reverse transcripts by causing an conformative change. So the example will be the alpha-vinazine. And the third one will be the protease inhibitor. So the mechanism is inhibit the protease enzyme and preventing the maturation of viral protease. So ritonavir. And the fourth one will be the integrase 10 transfer inhibitor. So the mechanism will be inhibit integrase and preventing the integration of the viral DNA into the host genome. So the example drug will be the raltegravir. And fusion inhibitor is the mechanism is prevent the HIV from the entering the host cell by blocking the fusion process. So the example drug will be the enfuvirtide and the CCR5 antagonist. So the mechanism will be the block the CCR5 co-receptor on the surface of the CD4 cell and preventing the HIV from the entering the cell. The example can be Marovirok MBC. So the last one will be the post attachment inhibitor. So the mechanism will be block the virus after the attachment to the CD4 cell and preventing the entry. Number 8 will be the pharmacokinetic enhancer, which is the booster. So the mechanism will be the booster is effectiveness of the other antiretroviral drug by inhibiting the enzyme that metabolize them. So the example of drug will be the ritonavir. It also a protease inhibitor, and also the last one will be the combination therapy. So the mechanism will be the combined multiple antiretroviral drugs from the different classes to enhance the efficiency and reduce the resistance. For example, Truvada, amphotericin and tenofovir. Okay. Next we'll move to the management of HIV AIDS. So first will be the antiretroviral therapy. So daily regimen of antiretroviral retroviral medication. So the goal is to suppress the viral load of the undetectable level and maintain the immune function and prevent the progression. Second, regular monitoring based on CD4 count and viral load. So the measurement, immunofunction, regular testing to monitor the disease progression and guide treatment. Next one will be the preventing and managing opportunistic infection. It's based on prophylactic treatment. It's prevent the infection like tuberculosis. The number fourth will be the adherence support. It's based on counseling and educations to emphasize the importance of adherence of ART to prevent the resistance and treatment failure. Number fifth will be the lifestyle modification. Is based on healthy diet, regular exercise, smoking cessation. Number six will be the mental health care, psychological support based on the counseling and mental health service to manage the depression, anxiety and other mental health issues. Number seven is the pregnancy and HIV. So ART during the pregnancy prevent the mother to child transmission of HIV, and also safe delivery practice reduce the risk of the HIV transmission during the childbirth, and also avoid the breastfeeding to use the feeding to prevent the HIV transmission through the breast milk if it's safe the alternative are available. Okay, this one is the antiretroviral therapy. What do is do? Antiretroviral therapy ART is a daily uses of the combination of HIV medication to treat the HIV, and ART save the lives but does not cure the HIV. So it also reduces the amount of HIV in the body and reduce the risk of HIV transmission, prevent the HIV from advancing to AIDS, and protect the immune system. Okay, next we move to the next slide. Okay, this one is based on the complication of HIV AIDS. First will be the opportunistic infection. So the infection that occur more frequently and are more severe in individual with a weakened immune system. For example, it's like pneumonia, a fungal infection causing the several pneumonias. Second one will be the neurological complication. HIV can affect the nervous system leading to various neurological issues. And number third will be the cardiovascular disease, which has increased the risk of heart disease and including heart attack and stroke. So the mechanism will be the chronic inflammation and direct effect of the HIV on the heart and blood vessel. Number fourth will be the cancer. It also increase risk of certain type of cancer. For example, Kaposi sarcoma, the cancer causing the lesion in the skin, mouth and other organs. Number fifth will be the kidney disease. The HIV associated with the nephropathy, even and other kidney related issue. So the mechanism is directly infected of kidney cell by HIV and damage the chronic inflammation. Number six will be the liver disease. So it's increased the liver damage often by the co-infection with hepatitis B or C. So the mechanism is direct effect of HIV, antiretroviral therapy, toxicity and co-infection of complications. Okay, this one is the neurological complication. Just now we discussed about neurological complication, right? So this one is that. So this picture is clearly explained about the neurological complication. First is yearly HIV infection of the CNS, and then immune activation, then lower the level viral replication, antiretroviral toxicity, comorbidity and substance abuse. So the last one will be the conclusion and takeaway. So the conclusion is HIV/AIDS is a chronic manageable condition with a proper care, and antiretroviral therapy ART is crucial for long-term health, and regular monitoring and preventing care improves the outcome. So the takeaway will be the early detection and diagnosis. So have to recognize the early signs such as fever, fatigue, and then the swollen on the lymph nodes. The second will be the adherence to the antiretroviral therapy. So the consistent use of the ART to suppress the viral load. And the number third will be regular monitoring and health checkups. So the routine CD4 count and viral load tests. The number fourth will be the lifestyle modification and preventive measurement is based on the healthy diet and regular exercise. The last one will be the managing coexisting condition is based on effective management management of co-infection based on hepatitis B, C, and tuberculosis. Okay, that's all for this chapter. Thank you.